Yeah, so I'll tell you a little bit more about my life as we kind of go through here. And like I said, I am a dentist. I'm a pediatric dentist, and so I work with kids. This is one of my own kids here. This is my daughter Alice. I got two daughters and a son, so they're good sports about letting us take pictures of them. Um, so this is my daughter Alice, and I'm a pediatric dentist, which means that my focus is taking care of kids. I see kids, but I am here at the University of Iowa, so I'm a faculty member here at the university, and I still see patients. I still am a dentist. I see patients a couple days a week, but the vast majority of my time is spent doing lectures, working in clinic with our students, and we have residents, and so we have the residents are students who have finished dental school that want to specialize, and I'll kind of talk about that some too. But so a lot of my days, a lot of my week, I should say, is spent teaching, not so much, always being a dentist as far as seeing patients. So like I said, my day-to-day activity is much different from a lot of my colleagues that are in dentistry. And I'll kind of talk about that as we go through here. But I think what I hope comes across is that that's one of my favorite things about dentistry, frankly, is that you can do so many different things in dentistry. People think of a dentist fixes teeth, and it's very clear cut, but it's not that clear cut. There's a lot of different avenues you can go down in dentistry, and we'll kind of talk about that. So I hope that comes through here, that there's a lot of things you can do. And I'm going to talk a little bit about different professions in dentistry as well as I go through here. So just a little bit of history, just because I like throwing fun facts in and stuff. The dentistry goes back a long, long ways. You can see here, 5000 BC, the Sumerians talked about it, and they talked about these tooth worms that were in the teeth, and these tooth worms that were causing pain and suffering in people. And so for a long time, we tried to fix these tooth worms with all kinds of different things like magic and sorcery, trying to perform rituals to vanquish these demons that were in the teeth. And this went on for a while, and usually when they got into these different treatments, they ended up having to pull the tooth that was causing the pain. And luckily, we've come a long way since then. And believe it or not, this whole idea of tooth worms wasn't really proven false until the 1700s. So this idea kind of went on for a long time. Dentistry, the first book about dentistry was published in 1530. But it wasn't really until the 1700s when dentistry became kind of a recognized profession, if you will. And this came about by way of Pierre Fauchard, and he was considered the father of modern dentistry. And then about 100 years after that the dentistry became a profession, was the first dental school opened up, and this opened up in Baltimore, and this was in 1840. So you can see that the idea of dentistry has been around for a long time, but it wasn't really formalized until the 1700s. And then the 1800s, we started to, teach in the dental school setting. And you could see, I found this interesting, even after the first dental school opened, that it wasn't until then that Colgate released their first toothpaste. So it's dentistry is old, but maybe not as old as you might think it is, I guess, was kind of what my takeaway was when I looked into the history a little bit more. For those of you that are on the call, I'm guessing, that maybe some of you are interested in dentistry. Maybe some of you are like, no, not for me. But I think I will tell you that I would encourage you to keep an open mind, because dentistry is, it's a great career. And like I said before, it's a career that allows you to do a lot of things and really kind of carve out your path, which is something I think that's pretty unique. You can't do that in all professions, but really dentistry gives you that ability. You can have most dentists are out practicing. They're in the communities. Many of you probably have gone to dentists in the community, and that's that's what you think of as a dentist. They have generally a pretty flexible lifestyle. If you own your own practice, you can kind of design your practice the way you want, the hours the way you want. If you want to get up and start at 7, you can start at 7. If you want to start at 10, you can start at 10. So I think dentistry provides people the opportunity to have an independent lifestyle and be flexible with their hours. Certainly the potential is there for people to make a good living, and you can take care of your family and do well in dentistry. You get the chance to be a member of the community, and someone that people go to for care, right? They come to you, they go to you for care. And, just my backstory a little bit. I grew up in a small town in central Iowa called Madrid. And I'm not sure where everybody's from on the call, if we're all Eastern Iowans or if there's a mix or what, but I grew up in a small town, about 2,000 people, right smack in the middle of the state. We had a dentist in town that everybody went to because that's where you went. You went to the dentist. And I really didn't even know, to be honest with you, I didn't know there was as much variety of dentistry as there was, because my history of going to the dentist personally was that I went, every once in a while to get my teeth cleaned, right? Twice a year, I think, was probably what I went. I didn't have, luckily, a lot of problems, so I didn't have to spend a lot of time getting fillings done. And then I got braces when I was a little bit older because I had quite crowded teeth. So I had some teeth extracted and some braces, and that was kind of it. That's kind of what I knew about dentistry. I didn't really know the full scope of what dentistry is. But I'm learning, every day I'm learning more about dentistry. But I think it gives you the chance to be, again, a member of the community. You can be that dentist that people go to in your town. You can be there for people to help provide healthcare for your friends and your family and your community. And it also gives you a chance to, shape the future of oral healthcare, right? You can really get involved in research. You can get involved in taking care of folks that are underserved, that need help. You have a lot of ways you can do a lot of good in the community. What's also pretty cool is that you can be a part of a healthcare team. So this here is a depiction of this. So the other part of this I didn't tell you is that my wife's a dentist too. So my wife's also a pediatric dentist, and this is actually her dental team, part of it anyway. And so, what she loves about dentistry is the idea that, she gets to work with these individuals as a team. They take care of their patients. And it's not just the dentist. There's a lot of people that are involved in taking care of people in a dental office. There's dental assistants, there's hygienists, there's dental lab technicians. So there's really a whole healthcare team, and it's a fun group. Her office has a really fun group of people. They work well together. They've got a good system. They understand each other, and they really can seamlessly take care of a lot of kids in their office. And so you get a chance to be a part of that team, especially if you go into private practice and kind of work, in that setting. My team here at the university, I have a team as well. My team encompasses a lot of people. Our team is students, and our team is individuals like Rachel who work with admissions, and we have dental assistants and residents. We have a whole huge group of people here. So we have a team as well, a healthcare team, but the healthcare team you think of as in a dental office is a little bit different and probably looks more like this picture here. Now, if you're thinking that dentistry sounds okay, but maybe it's not, maybe there's other interests you have, there's a lot of careers in dentistry you can get involved in that, maybe might interest you. We have dental lab technicians, and dental lab technicians, these folks are artists. They're the ones that design and make crowns and bridges and help fabricate different kind of prosthetic teeth for people that are missing teeth or that have to have crowns done. So they tend to work with metal and ceramics. And so, if you love to work with your hands and you love artistry, but maybe, dentistry is not for you for whatever reason, there's other careers in dentistry like this that can also, that are very much needed. And without folks working in a dental lab, we wouldn't be able to deliver the crowns and the bridges and all that kind of stuff that we make for people. So we sometimes overlook these folks, but they're very important to the whole success of our operation too. Dental assistants, generally dental assistants work alongside the dentist, right? So we have, dental assistants that work side by side with the dentist. They meet and greet the patient. They make x-rays. So when a child, for me anyway, when a child comes into the office, my dental assistant's the one that goes out and greets them and checks on their health history, makes sure everything's the same and brings them back, kind of starts to, for kids, a lot of times, we worry about them, the behavior, and are they going to be calm? Are they going to be upset? So they're the ones that have to kind of get them comfortable and bring them back. When we're working chair side, they're helping us to pass instruments and make sure that we can work efficiently and get this child's needs addressed in an efficient, safe manner. And it's impossible to run any kind of dental office or dental practice without dental assistants. You have to have good quality, hardworking dental assistants. And so, this is another area of dentistry that, you can also get involved in. And training programs are usually about a year long. Dental assistants can make a good living. You can be, you can work up to lead assistant and just take on more and more responsibility. So, these are kind of the unheralded heroes of most of our dental practices. Someone else that you might recognize, if depending on how many times you've been to a dentist or what you've had done at the dentist or that sort of thing, is the dental hygienist. Typically, the dental hygienist is the individual who also comes out to greet you, and they do the cleaning of the teeth, right? So they clean the teeth, remove plaque, the buildup that gets on your teeth, and the hard buildup called calculus. Dental hygienists work in a number of different settings. They work in, you think of them maybe as working in a dental office, but dental hygienists go out and work in the schools. They work in public health centers. They work in hospitals. So dental hygienists take on a lot of responsibility. A lot of times they work quite independently. And they have obviously a very important role to play in the overall care of our patients. A dental hygienist typically it's a pretty competitive field to get into. Typically, it's a 2-year degree that results in an associate degree. There's a lot of programs in the country, but like I said, they're hard to get into. There's definitely some wait lists involved. And the American Dental Association recently released a report that talked about dental hygiene being one of the fastest growing occupations in the United States. And so, again, another way to be involved in dentistry that is super important, super rewarding. It has much of the same things that come along with being a dentist, but there's other routes to be involved as well. But, I think the path to being a dentist. So a lot of you, I assume are here because there's an interest in dentistry. And I wanted to point this one area, or point you to this one area. I came across this a while back. It's called Becoming a Dentist. I put the link there. It's on the ADA's website, the American Dental Association's website. And it just tells the story of these 3 individuals who are starting dental school. And it's really a kind of a cool, look at what dental school is like. It's a lot of the same stuff you just heard from Paige. There's she said a lot of great things in there. And I don't know V, but I'm looking forward to meeting her someday too. I think they gave some really good advice and talked a lot about ways to be successful and that sort of thing. And that's a lot of what is in this Becoming a Dentist guide as well. So if you want to hear a little bit more about kind of what dental school looks like and the path through dental school, this is a good way to do it. But like I said before, there's so many career paths in dentistry. It's not as simple as just go to dental school, become a dentist, and set up practice. You can do that, of course, and a lot of people do, but you can also get involved in things like academics. For instance, like, you could come work with me. So, you could be here at an institution like the University of Iowa or any dental school around the country, frankly. And you could work with students and residents and teach. I really like what I do. I think it fits my personality and what I was looking for in a career. But private practice, like I said, my wife's a private practice dentist, and that fits her personality. She loves running a business. She loves being the leader of a team. She loves going to work and doing what she does. So you can kind of, again, find what works best for you, and you can really kind of steer in that direction. There's also great opportunities in public health, to work in public health, as a dentist. And, there's more and more of a need for this, trying to get to folks who need dental care and trying to make sure we're taking care of underserved populations. And there's a lot of great work that goes on in the public health field that you can get involved in as well. And you may have touched on this a little bit before, but there's a lot of different ways to specialize in dentistry as well. You're all probably familiar with a lot of different specialties in medicine. Dentistry is the same way. You can specialize in braces. You can be an orthodontist. You can be a pediatric dentist. You can be an oral surgeon who basically does surgeries and takes out teeth and that sort of thing. So there's a lot of different specialties in dentistry too. So it's, again, finding that niche, finding what you love, and finding a way to get there. And I won't spend too much time on this because I know you got a you got a pretty good overview of dental school and everything. But just to kind of to refresh your memory, dental school, of course, is generally 4 years after completion of a college degree. But like Rachel did mention, you don't have to have a college degree to go to the University of Iowa, for instance. You can do an early and mid type program, so that's not necessarily a must. But generally, 8 years after high school is kind of what most of us, probably the path that most of us took. There's currently 65 dental schools in the United States. And again, there are specialty programs beyond that 4 years of dental school if you want to seek those out. And they range anywhere from 1 to 4 years, depending on what you're doing. For instance, my path was, I went to undergrad here at Iowa. I applied to dental school and I finished my degree. I have a degree in exercise physiology. And then I went on to dental school here at Iowa. And then after dental school, I applied for pediatric dentistry residencies, and I spent 2 years training to be a pediatric dentist. I trained at a hospital in Rhode Island on the East Coast. So that was the first time I'd left Iowa. So that was my adventure out east. So I went out there and trained, became a pediatric dentist, and now I work, in this field in pediatric dentistry. So a lot of different ways, again, a lot of different ways to get involved in dentistry, a lot of different possibilities out there. But, I think overall, I think dentistry is it's a very rewarding career. It's a very enjoyable career. You have the ability to make a difference for people. You can improve someone's smile. You can make them feel better, get them out of pain. You give them better function, help them to eat, restore function if function has been lost for some reason. So it's a very rewarding career. I think most dentists, like I said before, most dentists do go off into practice and they work, and they either work with a group or they have their own practice or whatever the setup might be. But it gives that flexibility for them to decide how they want to spend their day, how they want to spend their week. Do they want to work 5 days a week, 4 days a week, 4.5 days a week, 6 days a week? You can really design, again, you can design your career how you want to practice. And in this, like I said before, dentistry provides the opportunity to have a good life, to have a good career, to have, to make a good salary. So that's certainly there too. But, I think to me, the dentistry has never been about the money for me. It's always been about the ways you can impact people and the effect you can have on people. So this is, again, my daughter, Alice. She's a good sport about pictures. So she's our little model for making sure that we always have pictures for presentations like this. And so a dentist overall, like you've kind of heard from us so far, a dentist generally is going to do things like you've probably had before done for you with examinations and x-rays, cleaning the teeth, that sort of thing. Sometimes we have to remove teeth that are not restorable. Some of us do braces. You can decide to specialize and just do braces, or some people do some braces within their practice as well. You can do things like making mouth guards for athletes. Maybe some of you play sports. If you do, I would encourage you to wear a mouth guard. I always try to encourage my teenage patients to wear mouth guards when they're playing sports. You can do things like that have an impact on people as well. And like I said before, what does a day in dentistry look like? It's so hard to say. And what's cool is you kind of get to decide what it looks like. But, for most dentists, I would say it's probably a pretty 8 to 5, Monday through Friday kind of thing. I always joke that most dentists don't work on Fridays. I do, and I know a lot do. But a full day of patient care is generally a combination of, cleanings and examinations, fillings, maybe sometimes taking out teeth. It just kind of depends. Every day is different. Every day is different, and that's kind of one of the cool things about dentistry is it's not the same thing every single day. It's constantly going to challenge you. It's constantly going to ask you to be ready to move with how things are going that day. You never quite know what to expect, and that's especially true in pediatric dentistry. You just never know what the day's going to bring when you're dealing with younger kids for sure. Like I said, procedures can vary. All these different things are going to play a role. And we also do some emergency care as well, and that's always part of this too, is that, emergency care doesn't happen all the time, but you have to be ready to take care of people in their time of need, when they need you. And that might be a fall at school. That might be, getting a a ground ball that hops up and hits somebody in the mouth and they knock a tooth out. It could be someone that has dental pain that happens at night and we have to go in at night and see pain. I mean, that kind of thing is part of the job too. But again, that's part of what we signed up for, is helping to take care of people when they need us. So trying to be there and be available for our patients no matter what they need. So I think what really makes dentistry so great to me is that it combines a lot of things. It combines, science. That's why the background of that first slide was, it's a couple of ladies looking at a microscope. You have to be science driven. This is like was said before, you can have majors that are different. We have people that were music majors and business majors, but at the core of dentistry is still going to be the science. So you have to have that science knowledge and that desire to keep learning. You also have to be a good communicator, because you spend most of your day, talking and interacting and making sure that, you can pass on the message of oral health to your patients. So you have to be not only have a science focus, but also be a good communicator. And, you have to, again, be curious, and you have to keep learning. Dentistry changes so fast that if you think you can just finish dental school and that's all you ever have to learn, you're not going to be a very effective dentist. So you have to continue to be curious and to grow and to learn. And, the people that figure that out are the ones that really do well in dentistry. So, so curiosity is always a good thing.